Good afternoon. Thanks for coming. I'm Tom Farley, the city's health commissioner, and we're here to announce the next step in fighting one of Philadelphia's biggest killers, which is high blood pressure or hypertension. We're going to be doing this by giving consumers information that they need to avoid consuming the highest levels of sodium. So a little background, 90% of people develop hypertension in their lifetime, 90%. And by the time the people even in their 60s, 60% have hypertension. It's an extraordinarily common condition. But hypertension isn't inevitable. We can prevent it. One of the reasons we have so many people with hypertension is that nearly all of us consume too much sodium over the course of a lifetime. The average person in America today consumes 50% more than the maximum recommended that people should consume in a day, which is 2,300 milligrams. So the average person, 50% more than the maximum. That high sodium intake day after day for years causes blood pressure to rise, and that high blood pressure increases the risk of stroke and heart disease. Now in Philadelphia, we have some of the highest rates of high blood pressure and early death from heart disease and stroke in the country. And those aren't statistics that we are willing to accept. So we all need to cut back on sodium. But how are people going to do that? The answer is not in the salt shaker. The salt shaker is a very small fraction of the sodium we take in. 3/4 of the sodium that we consume is already in the food when we buy it. It's in processed food and it's in restaurant food. The food industry puts that sodium into the food when they prepare it, before they process it. Some restaurants have food items that have way too much sodium in there, far more than the 2,300 milligrams that you should take in maximum for an entire day. For example, one chain has a burger that with all the toppings has 4,100 milligrams. And a chicken sandwich that has 4,400 milligrams. And then get this, a Chinese chicken wrap with 8,200 milligrams of sodium, more than you should take in over 3 days in one item. Now, what you may be surprised to hear is that those items don't taste especially salty, so that customers don't really know how much sodium that they're taking in. Studies show that people underestimate the amount of sodium in a fast food item by about 1,000 milligrams, and the higher the sodium level in the food, the more they underestimate it. So customers need to know what items have very high levels of sodium. With that in mind, back in 2018, the City Council passed legislation sponsored by Councilwoman Reynolds Brown to help customers make healthy choices. With this legislation, restaurants are required to put a warning sign next to any food item that has more sodium than you should take in an entire day. That is more than 2,300 milligrams in a single food item. That warning sign looks like this. There's a couple of different options. We got it in red, we got it in black and white. This says that a food item has more than 2,300 milligrams more sodium than you should take in an entire day. Now, there's a lot of science behind the design of this warning. Consumers understand these words, sodium warning. They know what sodium is, they know the warning means you shouldn't have it. And you have a yield sign there that we know from driving, that's a sign of being cautious. But even to help people further, the bill requires that if there's any food item with more than 2,300 milligrams in it, that also on the menu, probably at the bottom, is some explanatory wording. It says, sodium content higher than daily recommended, 2,300 milligrams. High sodium intake can increase blood pressure and the risk of heart disease and stroke. So with this label, for the first time, customers can easily see which items are extremely high in sodium, and if they choose to, they can avoid them. And that's what the bill is all about. Now, these requirements, which were passed a year ago, go into effect this Saturday, September 14th. Some restaurants have already posted these. You should look for those at your nearest chain restaurant. Other restaurants have requested a 6-month extension. So these are going to appear gradually over the next few months in Philadelphia. And we know it'll take some time for the residents of Philadelphia to get familiar with the warning signs and to understand what they mean. That's why today we are announcing a little help to that, an educational media campaign with these posters that you see here. It says, watch the salt, look for the label. These also have science behind them. We have tested these ads so that people understand that this is something that they should be looking for when they go to a restaurant. These ads are going to appear over the next 6 weeks. They're going to be on buses, they're going to be on digital billboards, there will be messages on radio, and there'll be messages on social media. Now, this is, I think, a major step forward in reducing the sodium levels of sodium intake of people in Philadelphia, but it's just one of many things that we're doing at the health department to achieve that. Other things we're doing including procurement standards for food that the city purchases. So when the city buys food for a variety of different programs, it ought to set a good example. And so we buy food with sodium levels that is safer through that procurement policy. We also have a good food, healthy hospitals policy, so that hospitals are committing to have healthier food, including lower sodium levels. And we have been working on a healthy Chinese takeout initiative with nearly 200 Chinese restaurants in the city for them to voluntarily reduce the sodium levels in the food that they prepare and serve. Ultimately, all this will, over time, reduce the blood pressure of people in Philadelphia and reduce heart attacks and strokes. So we're really excited about announcing this today, and we want to have an opportunity to hear from the councilwoman who really led the charge for this. Councilwoman Reynolds Brown has been a leader on so many health issues. I'd like to invite her on up now to talk. Thank you.
Good afternoon, everyone. Hello. So we're taking another major leap, we can say, in trying to be a government that is responsible and a government that cares about the health of its citizens. And as Commissioner has indicated, this is really a continuation of the work we started in 2011 around menu labeling. I'd like to give you the backstory on that. At that time, I was a fellow with the Robert Wood Johnson Foundation and was in the cohort where we traveled 4 cities around the country looking at how we were serving children, looking at how systems were serving children. During that time, the outfit in Atlanta, thank you very much, released an amazing report that talked about obesity, and that obesity was alarming across the United States, but it was a crisis in the African American community, and it was compounded for children of color. That struck me. As an educator, as a mother of an adolescent at that time, as someone who struggles with my weight on a daily basis, I joined the crowd that refused to, win the war. I'm battling that every single day. We decided to look at what can we as a government do when it comes to informing citizens about this new crisis. And you always have to do your homework first. And Seattle and New York were ahead of us in crafting menu labeling legislation. And so we decided we would take that on, and I'm here to tell you it took us over 2 years to get to 9 votes. We had to work one council person by one to yield 9 because for a lot of the reasons that we were faced with our interest in now wanting to advance another area with regards to health education, and that is sodium intake. And I will say to you, what I asked the health department to do for me is map out high blood pressure, diabetes, and it may have been hypertension by councilmatic district, right? 2 of the council persons that were in the no column had the highest incidence of diabetes. And I thought, wow, this is great information. So I shared that with those 2 council persons, and they came to the yes column, and we called a vote and was able to pass menu labeling 12-5. So fast forward, we're now tackling another issue, intake of sodium, that still impacts all of our communities in the way that our health commissioner has articulated. And what a thrill it is to work with partners and those who believe philosophically that we need to move in the same direction. And that's one thing I completely enjoy about our health commissioner. We may have different views on how we get there, but we share the end goal. And so facts are really important. As a former educator, we can all have an opinion, but you cannot argue the facts. And facts are really, really, really important. In our city alone, approximately 466 adult residents of our city have hypertension. That's nearly 500,000 people, or 4 in 10 adults in our city who are suffering with that. So we serve ourselves well. when we inform and enlighten with visuals, because you know there are all types of learners, and some have to be visual learners in order to get the information. So this is exciting in that we're now taking a legislative idea, discussions over many months, pushback from various stakeholders in the industry, and we expect that ultimately that yields a better outcome. We don't mind having the conversation and the debate, especially if we're going to end up with a real outcome. So we are here, and now we're going to lift this up on the radar screen and share with citizens across the city what sodium looks like and how it can really damage and change our lives if we don't change our habits. So thank you, Commissioner. Thank you to my staff, who oftentimes have to take a lot of those calls and then pull me in when it's time for us to really negotiate. We appreciate the important work, and there's still more work to do. How about that? Thank you very much, Commissioner.
Thank you. While we've been working on this issue at the local level, the American Heart Association has been working on sodium for years and really deserves a lot of credit for that. So we have with us today the Executive Director of the local chapter of the American Heart Association, Jennifer Davis.
Good afternoon, and thank you all for being here today. You know, with 85% of families purchasing food outside of the home at least 5 or more times a week, having sodium labels on our fast food restaurants or our chain restaurants, are more important than ever. We need to make sure that the healthy choice is the obvious choice, and then we need to make sure that our families are informed when they're making choices outside of the home. Heart disease continues to be the #1 killer of all Philadelphians, and stroke is a leading cause of long-term disability. I could probably poll the audience, and each one of you are affected by either or both of those conditions. 1/3 of adults in Philadelphia, have hypertension, which is a primary risk factor for heart disease and stroke, and certainly reduces life expectancy when more sodium is taken in. What can be even more troubling is the vast health disparity that exists in our great city. The prevalence of hypertension varies based on your zip code or where you live in the city of Philadelphia, whatever neighborhood that is. Where we sit today in Center City, the prevalence of hypertension is about 26%. Not too bad. But if we head north or west of Center City, it almost doubles to 47%. But one thing certainly remains true is that overwhelmingly there are links to excess sodium and hypertension or high blood pressure. It's tough for consumers to make choices when it's confusing. You talked about chicken sandwich. Most people, if you were to ask them, they would say a chicken sandwich is a healthier choice than maybe a hamburger, but sometimes that's not necessarily true. The American Heart Association works with cardiologists and physicians across the city who treat so many patients every single day with hypertension and the life-altering consequences that can come about as a result of uncontrolled high blood pressure. These emergencies can be avoided by cutting back on sodium intake, and as Commissioner Farley said, sometimes you can't see the salt. It's not your salt shaker that we're necessarily talking about. And the sodium warning label can certainly be a life-saving measure for many Philadelphians. At the American Heart Association, we are committed to addressing health disparities in our great city. As part of our efforts, we work with communities that are vulnerable in Philadelphia, and we work with clinics to address their hypertension management and treatment of their patient population. Through this work, we hear from families, boots on the ground, we hear from families that they don't know what foods are high in sodium. So again, this sodium warning label will make a big difference for so many. We need to continue to make the healthy choice the easy choice and the obvious choice, and to continue to educate our families on sodium and the risks of too much sodium in their diet. The American Heart Association continues to support the city's approach to making the healthy choice the easy choice. I want to thank and applaud the Commissioner Farley and the Department of Public Health for your work here, and of course for Councilmember Reynolds Brown for all of her support over the many, many years to advance and change policy right here in Philadelphia that is going to save lives. The American Heart Association stands beside our lawmakers in Philadelphia, and we continue to be at the ready to continue to advance these policies and legislation to create a healthier Philadelphia. So thank you so much.
All right. Anyone who just spoke is here for any questions you might have. We are spending approximately $50,000 for placement of the campaign. And I'm sorry, what was the second half of the question? Yeah, it will be on social media. It will be on digital billboards, you know, some of those that you see at the street level. It will be on buses, and there also will be ads on radio. Yes? We don't know which chains are going to be starting immediately or not. We're learning that ourselves. This is required for any chain that has 15 or more restaurants operating under the same name with the same menu at a national level. So any chain that you think of as a chain is going to be fall under this requirement, and you'll see those coming up, appearing gradually over the next 6 months in those chains. The law has a provision that we can issue fines if they are not issuing these labels. Our experience is that these chains are responsible, that will do this. But our inspectors already inspect the restaurants for a variety of other issues, and they're going to check when they're there. And we have a sense of what items we believe are already above 2,300 milligrams, and if we find that there are items that we think should be labeled and are not labeled, we'll talk to them about it and ask them to change. Yes? Questions? All right. Thank you very much for coming.